but for a woman who has gone through vaginal delivery, immediately the baby comes, you even dump the
Dump
baby
it on the woman.
take your baby.
Hey guys,
Hello.
welcome back to our channel, All Round Health Talk. So today we're going to be talking about a topic that is very important and has had a lot of traction lately when it comes to social media and life in general, and it is talking about C-section and normal vaginal birth. Lately, there's been a lot of debate and a lot of ruckus about if CS is good or not, and everybody and most people wanting to go for vaginal birth, even in cases where it doesn't favor them. So we're here to shed some light on what CS is all about and what vaginal delivery is all about, the complications, the pros and the cons of both CS and vaginal delivery, and we hope that you guys learn all you can from this video. So what is C-section? C-section basically means cesarean section, and it means the surgical removal of the baby from the womb of the mother, right? In the case where there is some situation whereby she cannot push the baby through her vagina, the surgeons would have to make a cut through her stomach and her uterus in order to bring out the baby, and this usually is done in the operating room of the hospital. So that is basically what CS is, but there are other things involved in both the process of CS and vaginal delivery that we feel is important for you all to know and learn from. So we're going to begin with, when is CS necessary? Like, when do you need to give birth through CS? Now Dr. Onye is going to give you the first point.
Okay, so there are so many indications for C-section, and the first indication we want to talk about today is multiple pregnancy. There are people who carry twins, triplets, and so on, and there are cases where we've heard of people who deliver twins, vaginal delivery, triplets, vaginal delivery. It's very, very possible, but all this depends on the position of the baby, right? Normally the babies will have to come with the head. So if these babies are aligned that way, fine and good. The woman's pelvis is fine and good. The baby will come out, but most times it's not that way. The babies are in different positions and it requires a C-section. So if your doctor tells you that your baby's positions, because they are multiple, require you to have a C-section, then you really need to have a C-section.
Yeah. So the next reason why your doctor would recommend you do a CS is if you have a chronic disease, like maybe high blood pressure, diabetes, or any kind of disease that puts you at risk for you to do a vaginal delivery. They would recommend you go for a CS. So in that case, it would be important for you to learn and listen to everything that your doctor has to say. If you have any questions about your chronic illness and how it's going to affect your delivery process, it would be a good time for you to ask your doctor and then be informed in order for you to make an informed decision. So that would be another reason why your doctor would recommend you have a CS instead of a vaginal delivery.
Your doctor would also recommend you have a CS if you have an infection that can put your baby at risk, especially if you have HIV or you have genital herpes. Now these infections, because the baby comes out from the vagina, that contact can cause the baby to have the same infection that you have. So to prevent that, your doctor would recommend you to have a C-section.
So another reason why your doctor would ask you or recommend you have a C-section is if you have problems with your placenta or the umbilical cord. Now we know that during pregnancy, the placenta position is very important. The normal position is usually at the top part of the uterus, but sometimes it could be at the side, sometimes it could even be so low that it covers the path where the baby is supposed to follow and come out through the vagina. So in such cases, there is a very impossible and even have increased risk if you decide to go through vaginal delivery. So in such situations, your doctor would advise you to go through a C-section because it would be safer for you that way. Because if there was any complication with the vagina. During vaginal delivery, you could even bleed out. You could have different kinds of complications that could lead to your to fatality, right, or for you to even lose your life. So in such case, your doctor would advise you to have a CS instead. And if there's any problem with the umbilical cord, sometimes the umbilical cord could wrap around the neck of the baby, sometimes just once, sometimes twice, and sometimes it could be so tight that it would even go as far as threatening to choke the baby, right, reducing the level of oxygen that the baby gets. So these are reasons where your doctor would advise you to have a CS, because if the umbilical cord is wrapped around the neck of the baby and you try to force it through the vagina, the umbilical cord could end up cutting, you could end up choking your baby, or it could even end up dragging the placenta along with it and along with the baby, causing more complications for you during vaginal delivery. So in such case, your doctor would advise you to have a CS, because it would be much safer for you that way.
Another reason your doctor would advise you to have a CS is the size of your baby. Normally in medicine, the baby's size above 4 kg, if your baby weighs more than 4 kg, then that is already risky for you to go for a vaginal delivery. So your doctor would advise you to go for a C-section if your baby is really, really big, more than 4 kg. And if the woman has a very small pelvis, okay, because the baby has to come through that pelvis, and if the baby is really big and your pelvis is this small,
tiny,
like, you already know what can happen. So in that case, your doctor would say go for a C-section.
Yeah. And another case where your doctor would recommend you to go for a C-section is if you go into premature labor, right? For some reason, a woman during her pregnancy might automatically go into labor when it has not gotten to her due date yet. So in this case, we might try to stop the labor using medication, but in the case where medication doesn't work and the labor continues, it would be safer for you to go through CS in order to prevent any kind of complications that could happen to both you and the baby while trying to do a vaginal delivery.
Another recommendation for a CS would be presentation of the baby, like I mentioned before. The position, the normal position that a baby is supposed to adopt for a vaginal delivery is head first, right? So if this baby is transverse, if the baby is coming out with the ass, or with one of the hands, or one of the legs, any position that is abnormal will require you to do a C-section, because if you go through with a vaginal birth in those abnormal positions, there's risk of fracture to the clavicles, fracture of the shoulders. Your baby might suffer from asphyxia. There are just so many complications, and bleeding to death too. So your doctor might tell you to go for a C-section, and you should listen.
Yeah, you should. And another reason why your doctor would recommend you go for CS is if, of course, emergencies, right? Emergencies like maybe you've been in an accident, a trauma, or maybe for some reason the baby starts to not receive the sufficient amount of oxygen that he or she is supposed to receive. Maybe for some reason the baby starts having some kind of complications in the womb of the woman, and then they would have to, take the baby out in order to attend to the baby separately. So in such situations, you would need to do a CS, an emergency CS in this case, instead of a vaginal delivery. So another reason, another emergency reason, well, not really emergency, but another reason why they would ask you to do a CS is if maybe you've passed your due date and you still haven't gone into labor, because there is a specific time where a baby is supposed to remain in the womb of the mother. So if that time range passes, a lot of things can happen to the baby, and a lot of things can happen to the mom, including sepsis, right? So it's very important for you to know this, and then in such cases your doctor would advise you to go for a CS. In that case, it wouldn't be like an emergency, it would be something that you would schedule, but you cannot take too long to decide instead. So in that case, your doctor would advise you, okay, your labor is not coming on, and it doesn't look like there's any sign of it coming anytime soon. So, and the baby is already developed enough for you to actually give birth. So if your body doesn't, jumpstart the process of labor, they would have to help your body to bring out the baby by doing CS. Yeah.
Okay, so well, those are the indications of a CS, right? Very, very good reasons why you should do a CS. Now we want to talk about the pros and cons of a CS and the vaginal delivery. So we're basically going to be comparing CS and vaginal delivery. Now, number one comparison will be recovery time and hospital stay. Now, a woman who goes through a C-section has tends to stay in the hospital longer than a woman who has gone through vaginal delivery, right? Because obviously it's a surgery. The woman has to be in observation to see how she responds. If she maybe for some reason some people come out of surgery and then it's like they just go down and they have to take them back in, so all that time for her to be in observation, for the anesthesia to wear out, for the pain to be controlled, it takes more time to be in the hospital compared to the woman who gives birth in through the vaginal delivery, because in most countries within 24 hours the woman is allowed to go home, or maximum 48 hours. Now you might ask, what is the big deal about staying in the hospital for a longer time? Now the hospital is a place where sick people go to, which means the hospital is one of the most contaminated places in the world. So a woman who has gone through delivery, a C-section, shouldn't be in the hospital for that long, because she would be exposed to what we call the nosocomial infections, which are infections that you get from being in the hospital, a place that is supposed to treat infections. So exactly, and that is not good. Those infections are really difficult to treat, so that's why the hospital stay is very important.
So another reason, another kind of cons of CX would be an increased rate of bleeding, right? Like I explained in the meaning of CS, it means when they have to surgically remove the baby from your uterus, which means that they have to cut from your stomach and go down to your uterus, cut your uterus open, and then bring out the baby. So you know that these are body structures that would normally not be cut if the woman goes through the vaginal delivery, but because they have to cut, and these structures have blood vessels that carry blood, and some of them are cut open during this process, so you have more risk of bleeding, or more quantity of bleeding than a woman who goes through the vaginal delivery.
Another comparison is scarring, right? C-section, it's a big cut. It's not like maybe the cut when they do an appendectomy, appendectomy, sorry. It's a very large cut, and so that means a very large scar, and for a woman, her body is really important to her, and so having to see that scar every time might even cause depression. So a vaginal birth has little or no scars, because if in the case you need to have an episiotomy and have to be stitched, it's not as big a scar as what you would have for a woman who has gone through C-section. So that is also a pro and con of both cases.
Yeah. Another con of C-section would be the infection, right? So we know that this is basically opening up the body of the lady in order to bring out the baby. So and some things could go wrong during the surgery. Maybe the surgical tools were not properly disinfected, or maybe the hands were not properly washed, or maybe even the gloves had some minor case of contamination during the process. Even the open air, because even in the air we have microorganisms that we can't see, so it increases the chances of the woman getting infection than the vaginal delivery. So
another comparison would be reaction to anesthesia, right? In vaginal delivery, you basically don't need that, except they would want to do an episiotomy. They will put a local anesthesia, which is not a big deal. But in C-section, you would have to receive anesthesia to your spinal cord region. There is risk of injuries happening just in that process alone. And then there are people who do not respond well to this anesthesia. So you could have reaction to the medication that is injected into you, and so obviously that is a risk for C-section.
Yeah, so the other risk for C-section is more like the con of C-section, which depends largely on the individual, would be increased level of pain, right? As we said, the recovery time for the C-section is longer, and I think one of the reasons why it is longer is because of the pain. Having all the structures cut open in order to bring out the baby, it's very painful, and it takes a longer time to heal this process, these cuts, than a woman who has the vaginal delivery. The woman who has a vaginal delivery might be sore for like maybe a few days, but a woman who had a C-section might be sore from weeks to even months, depending on the threshold of the woman or how she can endure pain. So yeah, that's another con of C-section. There's increased level of pain and healing process to be done.
Okay, another comparison would be baby mother contact or mother baby contact, however you want to put it. Basically, after a C-section, this woman needs to recover from the anesthesia. She has a lot of pain. She has to be lying down for at least the first 24 hours. She can't do anything stressful. So she doesn't really have the opportunity to have contact with her baby, start the breastfeeding process, and have that initial baby mother bond. So, but for a woman who has gone through vaginal delivery, immediately the baby comes, you even dump the baby on the woman, take your baby, so she can even start breastfeeding, and that bond is developed on time as compared to C-section. So that's one of the bad sides of C-section.
Yeah. So another con of C-section would be the immune system of the baby, right? So we know that in the vagina, there is a normal bacterial flora of the vagina. And during vaginal delivery, the baby passes through the vagina and the baby comes in contact with this flora. And then as a response, the baby's body starts to produce immune cells in order to combat that flora, which is a normal immunologic response in the body. But during the C-sections, because the baby doesn't have to pass through the vagina and get in contact with those bacteria, the body doesn't necessarily have to produce any immune system to combat bacteria that does not exist or bacteria that the baby has not come in contact with. So in this case, the immune system of a baby delivered through CS is slightly lesser than the baby who was delivered through normal vaginal delivery.
Another comparison would be respiratory infections or problems in the future. Now, when a woman goes through vaginal delivery, the muscles of the pelvis are contracting and relaxing. It's a whole process, and so during that contraction process, they can contract and squeeze out the liquid from the lungs of the baby, because the baby's lungs has liquids, and so they squeeze out this liquid, and this helps the baby's lung to function way better. Right? In C-section, the baby doesn't have this opportunity to have the liquid in their lungs squeezed out by the muscles of the pelvis, which means that a baby who is born through C-section has more risk of having respiratory problems in the future as compared to a baby who was delivered through vaginal birth.
Okay, so now we've given you the cons of C-section. Now we're going to give you the cons of vaginal delivery, because you know that these processes have both have pros and cons. So what the first con or first disadvantage of a vaginal delivery is that there is risk of fracture and asphyxia during vaginal delivery. Now, the fracture is something that most of us know, right? When a specific one or more bones of a body breaks, right? So because a baby has to pass through a tiny canal, which is the vagina, the baby might be slightly too big for the vagina, or maybe the baby might be dragged a little bit too roughly, or maybe the mother might not know how to push properly, and some mothers even go as far as giving up, and then they just close their legs and that's it, I'm not pushing again. So things like this can affect the baby in that it increases the chance of the baby getting fractured bones. Maybe one or two of the bones could break, you know, and this is a huge emergency. So it could also be that the baby could get asphyxia. Asphyxia is a process whereby there is blockage of airflow into the lungs of the baby. So due to some reason, the baby could go into that asphyxia, and then could affect the baby during the process if care is not taken, or if emergency protocols are not applied. So that is one of the cons of vaginal delivery.
Another con of vaginal delivery would be urinary and bowel incontinency. basically because of the closure between the vagina and the anus, the muscles there, if for some reason they are injured during the process of childbirth, they can have problems in the future with their normal job of contracting and relaxing, which is why most women who have gone through vaginal delivery have this urinary and bowel incontinence. They can't really control their urge to urinate or to poo. So that's one of the cons of the vaginal birth.
So another con of vaginal birth is having pelvic and vaginal injuries, right? So we know that there are some people who might not have access to highly specialized hospital, or some people who might depend on midwives, or even maybe their grandmothers who have been experienced 1 million years in giving birth to people's children, right?
600,000 years.
600,000 years experience, you know, so, and they might decide not to go to the hospital. So things like having a small pelvis, or maybe the baby being too big to pass through your vagina, might not be diagnosed on time. So in the case where this happens, you can cause pelvic injury, whereby the pelvic of the mother could fracture, right? Or the walls of the vagina might be torn open, because we've experienced cases where the baby comes out and then it's like, wow, I'm here, and there's tears, everything. And then you look at the vagina of the mother and it's a mess, it's a disaster, like there's cut everywhere. And then you have to start suturing and cleaning this up and cleaning that up. So like that's one of the cons that could happen during vaginal delivery.
Well, there you have it. Now you know the cons and the pros.
Yeah.
Now we want to drop our 2 cents, okay?
Mm-hmm.
If you are a woman who is pregnant and preparing to deliver, if you do not have any medical indication or any medical reason to go for a C-section, please go through the vaginal birth, because it is 100 times safer than the C-section. Right? So please and please, if there is no indication for a C-section, go through the vaginal birth, because that way you and your baby will have more benefits than through a C-section.
Right. And of course, if for some reason you need to have a C-section, maybe you have one of these things, one or more of these things that we've mentioned, and your doctor strongly recommends you go for C-section, do the C-section, because at the end of the day, comparing it to vaginal delivery, C-section might even be safer for you, right? I understand that in this case, maybe you might have to get the opinion of your spouse, or maybe ask for advice from maybe people you trust, but at the end of the day, you have to make an informed decision following the recommendations of your doctor, because you are the patient and you have the right to actually choose which method you want. You have the right to actually decide if you want the CS, right? So you might ask for opinions. It is good to have all the information at your disposal, but at the end of the day, the decision rests on you as the patient, right? So
basically that's that. Also, don't let religious, cultural reasons influence your choice. A C-section is the best thing if you have these indications we've given.
Doesn't make you less of a mom.
Exactly. You're as much of a woman as the other woman who gave birth through vaginal delivery. So please, let's stop this whole stigma towards women who give birth through C-section, because they're both the same. Right.
One day we'll even talk about IVF.
Yeah.
One day we'll
doesn't
talk
make
about
you
that
less.
too.
Okay, borrowed wombs doesn't make you less. We're all women.
Yeah.
Okay, so thank you. I hope that you've enjoyed this very long video, but I hope you watch it to the end.
Yeah.
And please remember to subscribe and put on your notification button so that you can get notification every time we post a video. Also, give us some thumbs up and leave us a comment, a question, whatever you want to say to us. We'll be here watching out for that. And share this video to your loved ones, to any pregnant woman you know, to people who are aspiring to be mothers.
Yeah.
Just share the video and let us all be informed together. Thank you for watching. See you in our next video.
Bye.
Ciao, ciao.